Symptoms of gum disease could be bleeding or swollen gums, red puffy gums, receding gums, bone loss, or even bad breath. Well, sometimes a patient will come in and report on their own that their gums are bleeding. And if they notice that their gums are bleeding, I'm going to notice that their gums are bleeding badly. Or they might say, oh, they bleed once or twice a week. So that already alerts me. But when I take a look with my mirror, as soon as I look in there, I can tell. And we do something called probing that also will provocate the bleeding, and then we can see if it bleeds easily, we know that they have a problem. Plaque begins with the normal bacteria that live in our bodies and live in our mouth. And when it has an opportunity to gather together and collect on the teeth, it becomes a sticky film, which then becomes potentially more dangerous for the gums. And once it's had a chance to colonize, get together sort of like a gang, then it can produce harmful chemicals that can actually get into our gums and then subsequently into our bloodstream.
Now, today we're understanding that gum disease is not just a local disease in the mouth, but it's really a systemic disease. The bacteria that can grow in the mouth can invade through the gums into the blood vessels and get into the heart and the brain and other parts of the body. Inflammation that's occurring in the mouth tends to exacerbate inflammation in the body, and together it all builds and promotes more disease in the body. So one of the major challenges in treatment of gum disease is to get control of the plaque that builds up on the teeth. It's not enough for most patients to go into the dentist and have their teeth cleaned every 6 months. Sometimes the plaque is growing, and within a day or two after having a dental cleaning, the plaque is back on their teeth. The other side of it is the systemic side. If there's chronic inflammation in the body and conditions within the metabolism of the patient that favor bone breakdown around their teeth, we've got to address that. So we'll screen our patients using applied kinesiology and acupuncture techniques. We'll often find that there may be problems for them in the function of their liver or their intestinal system. And then we'll make a referral to a nutritionist or physician who can help diagnose that aspect of their health condition and get things back on track for them. So again, we find that because it's a systemic disease, gum disease is best treated with a systemic approach. For us to address the conditions in the mouth, having a physician or a nutritionist working with the systemic issues from a nutritional perspective, and together we end up getting the best results.